COVID-19 in Simcoe, Muskoka. To date, we've had 165 confirmed COVID cases in total, 70 recovered, 12 hospitalizations, and 11 deaths. We do have an additional 3 deaths since I last reported 2 days ago, and I would like to express my condolences to their family for their loss. I will be speaking in detail regarding these deaths as well as other matters today. First, to draw attention to our most recent cases, we've had 14 new cases since I last reported. 2 of these are related to the long-term care facility outbreak, Bradford Valley. And we've had an additional 12 cases out of the 14 that are sporadic cases, as we say, cases in the community not associated with that outbreak. They range in age from under 10 to in their 80s, and one of these is hospitalized, a male in his 70s in Barrie at RPH. The others are in self-isolation. 1 acquired through travel, 3 close contacts with other cases, 4 a community acquired, and 4 under investigation. With regards to the 3 deaths, 2 are associated with Bradford Valley Care Community, both having passed away in the last 2 days, on April the 13th and 14th. Both of them passed away on the premises at the facility. And then we have a male in his 70s who passed away in RVH, previously identified as one of our cases, admitted late March, and travel related. If I draw your attention to Bradford Valley and the outbreak there, in total we have now 29 laboratory confirmed cases, 7 of whom are staff. 5 of those 7 live in Simcoe, Muskoka. The other 2 live in York region and therefore aren't on our line listing. And we have 24 residents in total who've been confirmed with laboratory positive tests for COVID. 3 of those residents have passed away, and we have others who are quite ill, including an individual who was admitted to hospital that I previously cited in a verbal report. We've had some questions about testing at that facility, and what I would like to say is that we are actually testing everybody at that facility. We have submitted tests for all of the residents associated with that facility and are working through testing all of the staff. We're doing so in partnership with the assessment center at South Lake Regional Health Center, and that will actually result in over 500 people having been tested. So this is an unusual thing to do. We've done so at the request of the medical director, and we've done so because of the large numbers of people who are cases, and we feel it would be beneficial to be able to get a complete handle on how many cases there are. There is a potential for asymptomatic transmission with COVID-19, so it is possible that some of them don't have symptoms, and so if we can identify those that are positive, we could ensure that they're in isolation and protect others. That facility is also operating with staff wearing masks at all times in all encounters with the residents as an additional protective measure, and South Lake Hospital is providing support potentially in the way of staffing if they need it. So we're working very closely both with the hospital and with that facility in the response to this situation. We do not have any other COVID outbreaks of long-term care facilities tested positive in Simcoe, Muskoka. So while we do have a number of other facilities in Simcoe, Muskoka that have outbreaks, testing to date has not been positive for COVID-19, and we are expanding our testing in all of those facilities in keeping with provincial direction now that we test not only those that are symptomatic, but any contacts they've had among staff or residents, whether or not they have symptoms. So that expands out the testing requirements in those facilities, and we are carrying that out. I'm just going to draw your attention to our health stats page about COVID-19. If you look at our overall statistics, as per usual, the largest number of people to be infected in Simcoe, Muskoka are those aged 35 to 64. Another large group are those 65 and older. If you look at the status of their infection, 70 are recovered, 50 remain in self-isolation, or another 20 in isolation with a long-term care facility. We have 12 that are presently hospitalized, the total of 11 who are deceased. One individual who's out of the area went to the United Kingdom. And if you look at where people contracted their infection, 48 of them contracted it from travel, 35 contracted it from close contact, 24 from contact in the long-term care facility, and 46 community acquired, another 12 that are under investigation. So I always point out there are two major issues here. One is travel, and so we still have some people returning to Canada. They do need to go into self-isolation by law under the Federal Quarantine Act for 14 days to protect others, to be sure that they're not going to transmit to other people. And we have an ever larger number of people that have acquired this in the community. That speaks to the importance of everybody exercising physical distancing, 2 meters apart from other people when you're out, avoiding crowds, thinking carefully about whether or not you really need to be going out, choosing discriminately about whether you go out or not. If you go shopping, one person in the household, do it once a week, go in, get it done, do it safely in the ways that we've described on our website, and then go home. And if you develop any symptoms, you need to be putting yourself into self-isolation for 14 days. And if you can, get tested. We're now able to test more people in our assessment center. So before it was difficult to get tested, and we had to really focus in on high priority groups such as healthcare workers. We still have those priority groups, although the list is larger, and it does include first responders as well. But I would say that there's more capacity. It's helpful to have a positive test result, to know your status. It helps us because we can follow up with you, make sure you are in self-isolation, and we follow up with your contacts to make sure they're in self-isolation. It really just helps all around to flatten the curve and avoid the surge and avoid overwhelming your healthcare system. And it's certainly just good to do all that we can to avoid transmission to others. So we've got a listing also of all of the municipalities on our tally, so you can see which municipalities have had positive cases. I would say you should assume it's everywhere. You should assume that there's community transmission happening everywhere, and therefore you need to take those precautions that I've described. If you look at our epidemiological curve and you discount the last 2 weeks of data, because in that 2-week period we may very well be getting people just emerging now as ill and then seeking testing, so we don't have a full data set for those 2 weeks. But if you look before that, it's starting to look hopeful. It's starting to look like it's leveling out. And by no means do I want any of us to be complacent. If it's leveling out, it's because of the good work that we're all doing in physical distancing, in flattening the curve together, in breaking the chain of transmission. And I want this to be encouraging to people, that we have some positive evidence here of an effect from everything that everybody is doing together. I'm just going to have a look at my notes of key things that people wanted me to speak to. I was asked about assessment centers and whether or not there's been an increase in the amount of number of individuals going to assessment centers since we've been promoting that they do so, and since there's been greater capacity in the laboratory, public health laboratory system to do testing. And I said I would get back with data. So I got some data, and indeed it does look like there's some increase in the number of people being assessed and tested at our assessment centers. So if I look at Barrie and if I look in Collingwood, indeed it looks like it's gone up, at least somewhat. It's not completely clear to me that it's gone up in Orillia or Midland. If I do look to Muskoka, it's at least holding its own, perhaps gone up a bit, which is certainly is good. It's good that there's some evidence that it's going up. So I see some evidence that there is an increase in testing in our area. We've had questions here about the province strengthening the protection of residents in long-term care facilities and retirement homes, where there is the greatest degree of risk. It's been cited in the media. Quotes from the Chief Public Health Officer of Canada, Theresa Tam, that close to half of the deaths that have occurred in Canada have been associated with long-term care facilities, and that we need to do all that we can to protect people in those settings because they're so vulnerable. So there's questions about the ways, what we've been doing to address that situation. I've already talked about Bradford Valley and the fact that we've swabbed all of the residents and are swabbing and testing all of the staff. We will await results coming back on that, but that is one action above and beyond what we've been called upon to do from the province. I've already cited the collaboration we're doing with South Lake Hospital to support this facility. I have personally reached out and spoken with the medical director and nursing director, and I would also say that the Chief Public Health Officer of Ontario, Dr. David Williams, is very interested in this assessment that we're doing, testing everybody at the facility, and he's aware of a total of 5 such facilities across the province where testing of the entire facility has been done or is being done. And so the province wishes to learn from this experience to see if that needs to be broadened out as a practice elsewhere. We had a question about trailer parks and campgrounds. They are closed, but there is an exception for the trailer parks. Trailer parks will allow people to return to their trailer at the park if it is their only residence, and they're, in particular those returning from overseas, from out of country, who need to go into isolation and they need a place to go. So we're allowing them to use their trailer at a trailer park for that purpose, those who don't have anywhere else to live. There's some concern we've noticed on social media about people not abiding by the physical distancing on the weekend and getting together and socializing in groups and that kind of thing. And so I would like to emphasize the importance of us all doing our part to protect ourselves and our friends and our loved ones and to reduce the transmission of COVID-19 in the community by maintaining the physical distancing, by abiding by provincial legal direction that we are to not be in gatherings more than 5 people in public. And I always say that when it comes to intimate contact, you should be limiting yourself to household members only, and otherwise avoiding gatherings or creating gatherings of people. We've all got to continue to do this to flatten the curve. We are having an impact. We need to keep up that impact. It's like the floodwaters. If you remove the dike, the floodwaters return. We can't be complacent about this. We have to keep this up. There are questions about how long. it would be premature to stop at this time. Certainly the Premier has signaled that by an extension of the state of emergency into mid-May. We've had a media story with some questions about 2 Walmart employees who tested positive, communication from Walmart head office about 2 local Walmarts, 2 local employees. I think there was citation of the cities in which this had occurred, and questions have come up about whether we as public health needed to be communicating about that. What I would share with you is that we indeed are aware of the employees in question and have followed up with them and have identified contacts that are relevant for them that we then followed up with to put people in isolation. And we've assessed the degree of risk for everywhere that they've been and have identified that the risk is low to others in the public, and therefore we did not come forward with announcing this. This would be in keeping with many environments that we've become aware of through the line list of the people that we've assessed, and in every instance we've identified those who've been close contacts to go into isolation, and we've notified them directly ourselves and are following up with them. What I would say about risk environments in the community in general is that this is transmitting in the community now, and you need to assume with asymptomatic transmission, with people without symptoms possibly transmitting, that you need to exercise the physical distancing of the 2-meter setback from other people, and be doing the frequent hand washing and being selective and careful about going out at all, and certainly avoiding crowds, and isolating yourself at home if you are ill. You need to assume that the risk is everywhere and not assume that you can avoid the risk by knowing of certain places and avoiding them. You need to assume it's everywhere, and you need to take that kind of precautionary approach in all settings. There was a question about long-term care facility residents being diagnosed with COVID-19 and whether or not they should all be going to hospital, and those that pass away, and that they pass away in the premises, what does that mean as opposed to them not going to hospital? And what I would say is we have one long-term care facility outbreak, Bradford Valley, and I have spoken directly with the leadership of that facility. They're well equipped, having worked through with the residents and their family members about their plans for what they prefer about care and whether or not they would want to be kept comfortable and given good care at the home as opposed to going to a hospital, and those wishes are being respected. And so in most instances, people or their family members prefer they stay at the premises. It's well equipped to provide support and comfort and palliative care as needed to manage the situation in keeping with the wishes of the family members. So to date, we've only had one resident go to hospital, and that is in keeping with the wishes of the resident and family members. So there's a question here about, do you feel that the newest long-term care facility measures go far enough to protect residents and staff? There's a lot in place, and what is another thing that's new is the Premier indicating, though we need to see it as a written directive, the Premier indicating yesterday that staff in long-term care facilities are to not work in more than one facility, and that is meant to reduce the likelihood of transmission of COVID-19 between facilities. Certainly we welcome that. We welcome the requirement that staff are to wear masks at all times in order to reduce the likelihood of transmission in the facilities. We welcome that there aren't to be visitors on the premises apart from outdoors 2 meters away from the residents by family members. We welcome that there is to be screening of all residents coming in, testing of residents when they come in, isolation of them for 14 days, and in particular when they come from hospital, and that they need to be testing anyone who has any symptoms at all and their contacts, whether or not they have symptoms, and that there is to be ongoing close monitoring of residents and staff every day. We welcome all of that. All of that is needed. The question of whether or not everybody on the whole premises should be tested when there is an outbreak, I would say, is being assessed by the province right now, and our own example of having proceeded with that would be part of that assessment. So, some questions about masks and their use or incorrect use, and questions about use by children. So I would welcome people coming to our website and looking at our information about masks. To cut to the chase, I would say, first off, that people need to be doing the physical distancing to protect yourselves, and that you should not be using surgical masks or N95 masks or procedure masks. They should be reserved for people at hospital or in healthcare to be using, because there's a shortage of them right now. And then if you are considering using a mask, that it would be a cloth mask, a homemade mask. It's certainly not generally recommended, but if you want additional protection, particularly I would say if you are going to be in an environment where you can't do the physical distancing, you're too close to people, that a cloth mask may be helpful to protect others from you, the person who wears the mask. It's protective of those around that person more so than that person, in the case of the homemade cloth mask. And this is important because people can be asymptomatic with this and shedding virus and potentially infecting others. But also that children under the age of 2 should not be using a mask at all, because of the potential for asphyxiation or interfering with their ability to breathe. It could be quite dangerous for them. Okay, so just having a look here. So there were questions about Bradford Valley and the residents and hospitalization, which I've already addressed. There was also a question about our other long-term care facility outbreaks. We don't have any hospital outbreaks, but we do have a number of other long-term care facility outbreaks. And we continue to test them. As I'd already indicated, we've gone back and done more enhanced testing. And so far, none of them have come back positive for COVID-19. And it is quite common to have outbreaks at this time of year and through the winter in long-term care facilities. And then there was a question about the breakdown of hospitalized cases. So generally speaking, we don't provide detailed information about cases to avoid the identification of individuals. We have to protect people's privacy. So at this point, I'd be happy to take any questions that people may have.
Okay, it's Kathy here. Eric Engel from Collingwood Today. Do you have any questions?
Yeah, could you actually come back to me? Sorry.
Sure.
Is that okay?
Yeah, no problem. Dawn Huddlestone from the Huntsville Doppler. Do you have any questions?
No, mine's been answered already. Thanks, Kathy.
Okay, thank you. Dana Goldfinger from Global. Do you have any questions for Dr. Gardner?
Hi, yes, I do. Hi, Dr. Gardner. So just to clarify, there's 24 residents at Bradford Valley that have been diagnosed with COVID. How many staff members were there again? We just missed that.
A total of 7 staff have tested positive. 2 of them don't actually live in Simcoe, Muskoka, so they're not on our line listing that you can see. They live in York Region.
Okay. And how many residents are in the facility in total?
If I recall correctly, it's well over 200, 260, something like that. It's our largest facility.
Okay. And I remember the last teleconference I was on, the cases were relatively mild. What's changed since then that now some people are dying?
Yeah, thank you for that question. It is distressing to me that they progressed like this, and perhaps I should not have been surprised because of the experience in other long-term care facilities and what we know of the case fatality rate in people above 70 years of age, and in particular those above 80 years of age. It can be in the range of 20% of cases for those above 80 years of age. So perhaps I was hopeful that they would remain mild, but they progressed in their severity, very unfortunately.
Great. Thank you.
You're welcome.
Okay, great. Doug Cross from the Muskoka region. Do you have a question?
Yeah, hi. I was just trying to sort of summarize the cases in Muskoka. And two that stick out for me is cases 36 and 37, two people from Gravenhurst, who are past their 14-day self-isolation standard, but they're still showing as self-isolating. I'm just wondering, how are we updating these cases? Is the primary care physician reporting back to you, or do you follow up? Because, they're still marked as self-isolation.
Thank you for them. We are following up. I don't have that detail on hand, but I'll look into it.
Okay, that's me. Thank you.
Okay, thank you, Doug. Nathan Schubert from Moose FM. Do you have a question?
Nothing for me to say. Thank you.
Okay, James Buller from Cogeco. Do you have a question?
Yeah, thank you. Just one question. I'm just wondering if we do have a specific update on the numbers for tested in Bracebridge and Huntsville, those centers.
Okay. So when I look at Bracebridge and Huntsville, Monday, Tuesday, they are open 5 days a week, just so you know. They aren't open on weekends. So when I look at Monday, Tuesday, for Huntsville, it was like 16 cases between those 2 days, and for Bracebridge, it was 23.
All right, that's great. Thank you.
You're welcome.
Thank you. Mandy Webster from Rogers. Do you have a question?
Hi there. Yes, I have 3 questions today, Dr. Gardner.
Mm-hmm.
I'm just going back to the top of the list and looking at some of the hospitalized cases that are still hospitalized. It's coming up to a month with those hospitalizations. Can you speak to those at all?
So I cannot speak to individual cases. We do protect privacy, but I would say that hospitalized cases are severe cases, and half of them end up ventilated, on a ventilator, intubated. And it's a long recovery. It can take a long time.
So that's not, not that you're not concerned, but you're not maybe surprised that some people will have to stay up to 3 weeks, 4 weeks, 5 weeks in hospital.
Yeah, I certainly feel for them and their family members. I'm sure it's extremely hard for them as an experience, and it's unfortunate, but not unanticipated.
Okay. And I read a lot of articles and charts and graphs saying that people are thinking that the curve is starting to flatten in Ontario. You have mentioned that you don't feel like we're flattening quite yet, but we're on a consistent increase. But do you expect a spike because of the broadened scope of testing now?
Do I expect a spike in testing? Was that your question?
Sorry, a spike in positive cases with the broadened scope of testing now that we can test people who haven't traveled and paramedics, etc.
Yes, that would not surprise me. It would be a good thing to find cases. On one hand, we would have, if that happens, a surge in tests that are positive on individuals. It might be that if they've been delayed in getting tested because they couldn't get tested before, that if we look back at the date of the onset of symptoms, it's 2 weeks in the past rather than showing up as a spike of new cases happening right now. So it might be more reflective of a look back into the past a couple of weeks. But yeah, that might push up the numbers and might complicate for us the interpretation of whether or not you're peaking at this point, whether or not you're plateauing, whether or not you're going down. It's not the only indicator that we look at. We also look at severity of cases, we are not missing the severe cases. That is happening. They end up in hospital and they all get tested. So what we would expect to see if we saw a surge that was simply related to enhanced testing is an increase in the number of milder cases that are being managed in the community. So we'd have to compare and look at the big picture and note that although the community cases appear to be going up, the hospitalized cases are not. And that would help us to interpret what we're seeing.
That's great, thank you. And just one last quick question. Kind of a different one, and I don't know if you have any insight on this, but I've heard quite a few stories of people giving up their animals as pets because they're afraid that they can catch COVID-19 from their animals or in turn give it to them. Do you have any insights on that?
So that question has been raised before, and I think a case of a tiger in a zoo kind of thing has come up before. So in theory, it is possible for other mammalian species to get COVID-19. There have been rare instances of it having been documented. It is not common, and there have been no instances of transmission back from a pet to a person. So I think that it would not be necessary for people to get rid of their pets for this purpose.
Thank you.
Natasha from Bradford Today, do you have a question?
Yeah, for the staff at Bradford Valley, do you know if any of them were working anywhere else?
None of them were working elsewhere. We did check with regards to potential for other facilities to be affected, and none of them were.
Okay, thank you. Thank you, Natasha. Adrian, do you have a question?
No, my questions were answered earlier. Thank you.
Okay, thank you. Erica Engel, are you ready to ask a question?
Yes, thank you very much. Sorry about that. Going back to testing and the criteria being opened up, local testing centers apparently having capacity. In my experience, there's been a lot of people who have been told, like, if you can manage your symptoms at home, then don't bother going to get tested. Have you changed that messaging now?
I agree that it's a change, and I myself was saying that before, and that was back when there was a backlog of testing the province needed to catch up. The public health laboratory system didn't have the capacity to keep up. But now that they've caught up, I think it's very beneficial for people to know their status. We know that the countries that have done the best in controlling COVID-19 and flattening the curve and avoiding a surge did a tremendous amount of testing and case and contact follow-up. So I would want for us to be in that camp, behaving in that way, being able to succeed in that way. And thus, I think it's a matter of communicating this out. I would say that I'm ahead of things a bit in my messaging. The province still has priority groups. They haven't actually quite said what I'm saying, which is, yes, the priority groups should be tested, but beyond that, I think there's value in others knowing their status. And many of the test results that we've gotten back lately have been people who aren't in the priority group but went and got tested, and it's been beneficial for them to know their status. It's beneficial for us to know it.
So are you suggesting then, like, anyone, like, do they have to have a symptom, one symptom, two symptoms? What do you think?
I hear on the side of inclusion, certainly for isolation. You have a sore throat, put yourself in isolation. Consider that you're a case. Keep yourself there for 14 days. The value of getting a test in that instance is you can, if you have a negative test, that means you can just wait till your symptoms have abated and then you can go. You can be released, right? Versus if you don't know, then you've got to stay in isolation for the 14-day period. So I think a single symptom of concern is worthwhile. I would suggest you can call ahead so that you can get a sense as to whether their receptiveness, whether or not they're able to do it. But I think people need to be erring on the side of inclusion with this.
Okay, and sorry, just further to the outbreaks that are included on the Health Unit website, I did ask about hospital because Waypoint is listed there as well. I'm just wondering, the reports that say it's not influenza, does that mean that COVID-19 has been ruled out as well?
If there was COVID there, then I'd be talking about it now. It would be on our list for COVID. So it means that we've had tests, all of our laboratory tests for long-term care facilities. All of those tests include COVID tests. So they've all had COVID tests and have had some negatives back. It's important that we keep testing, and we test very broadly in keeping with the new directive from the province on that, and even test asymptomatic people that have been in contact with people that have symptoms. So we have to keep looking, because even with a negative, you might miss it. But if they had a positive, I'd be talking about it now. It'd be on my list of COVID cases.
Okay, so to clarify, all of the places listed on the House unit as current outbreaks, you have already checked that there was COVID?
Yes.
Thank you.
Okay, Mike Arcelides, do you have a question?
Yes, Doctor, just to repeat and reiterate the deaths. What were those again? Who were they? And what were their cases?
So, 3 deaths, 2 associated with Bradford Valley. These are new deaths since I last spoke, okay? So 3 deaths.
Yeah, go ahead.
3 deaths, 2 associated with Bradford Valley. One passed away on April the 13th, the other the 14th, 2 females. And then 1 male in his 70s passed away, lived in Barrie, was at RVH since late March.
And that's travel related.
Yes.
Okay.
Do you have another question, Mike?
Yeah, with regards to, you alluded to it, the flattening of the curve here. Do you believe we're approaching that right now, or is this, a false sense of optimism here?
I am becoming optimistic, but I think we need to be extremely cautious for 2 reasons. One, I could be wrong, right? It could still, surge could still happen. Another is we can't be complacent. If we're succeeding, it's because of what we've been doing. And like floodwaters, they'll come back if you remove the dike. If you stop what you're doing, it'll all come back.
Do you have another question, Mike?
With regard to the long-term care home here, would it be advisable, we're seeing a lot of people that use that as a measuring stick on Facebook, people saying, I'm going to get my mother, I'm going to get my father out of there. Is that advisable, or should they be staying where they are to avoid the potential for more community spread?
I think that's a complex question, because people in these homes...
What would you advise? I'm
going to give you my answer. So I think that's a complex question, and I think that people would have to look at their own circumstances, because there's a potential to do a great deal of harm if you, as a family member, remove somebody who needs intensive care and you can't provide it. You take them out and you're unable to provide them with the care they need, then you're doing harm. And right now, if you remove somebody from a home, I believe the last communication I saw, they aren't allowed back in again until the pandemic is over. At a minimum, if they were allowed back in, they'd be put into isolation for the first 14 days, because they could very well be bringing COVID with them back into the home. I'm sure that people have excellent reasons for using homes for their family members, so they'd have to look carefully at those reasons before deciding they're going to be removing somebody. I do recognize that, according to media reports, there are over 100 homes affected in the province. Maybe 15% of the homes are affected in the province, and that there's a potential for more spread. And so there's danger right now. Undoubtedly, there is danger for residents in long-term care facilities at this time. So individual decision, people have to make it for themselves depending on what the alternative looks like for them.
What would you do?
I would use the approach I just gave, which is I would ask myself, am I able to provide the kind of care that this person, my mother, my father, would need? Am I up to that task, or are they better off where they are? I'd ask a lot of questions, I think, about the precautions that they're taking at that facility and what their backup plans are if they end up with an outbreak. I think it might also influence whether or not they are an outbreak, that kind of decision.
Thank you,
Okay,
Doctor.
thank
You're
you.
welcome.
Is there anyone on the line that we have missed? Okay, I would just like to let everyone know that we are going to be taking a look at our Facebook Live questions, and we will answer some of those common ones at our next briefing, which will be on Friday. Thank you.
Goodbye.
Thanks, Kathy.